I am going to talk about FDA-approved SGLT2 inhibitors available in most countries, and why they are a better choice in my opinion. Mainly they are cheaper than insulin and GLP-1 medications. You can also combine them with other cheaper medications like metformin in most cases. Prices may vary based on medication and market manipulation systems in various countries. The second thing is they are easy to take, just a tablet. The third fact is most of them have benefits for the heart, kidneys and other organs in the body. Talk with your healthcare team about that choice and may be advisable to take a second opinion from another medical professional. There are 4 medications available as at present. Sotagliflozin sold under brand name Invokana. Dapagliflozin brand name Farxiga. Empagliflozin brand name Jardiance. Sotagliflozin brand name Steglatro. These medications are primarily used in the management of type 2 diabetes mellitus. They work by inhibiting SGLT2, a protein responsible for reabsorbing glucose in the kidneys, thereby increasing glucose excretion in the urine and thus lowering blood glucose levels. SGLT2 inhibitors work by blocking the action of the sodium-glucose co-transporter 2 known as SGLT2 protein in the kidneys. This protein is responsible for reabsorbing glucose from the urine back into the bloodstream. By inhibiting or blocking the action of SGLT2, these medications prevent the reabsorption of glucose. This leads to increased glucose excretion in the urine, a process known as glycosuria. A major issue with this class of drugs is urinary tract infections called UTI. You can minimize the chance of getting UTI by lowering your carbohydrate intake. I have been using one of them for the last 10 years, but never had any issue with urinary tract infection. I will tell you which one I was taking later in the video. As a result of this mechanism, SGLT2 inhibitors help lower blood glucose levels in individuals with type 2 diabetes by promoting the removal of excess glucose through urine. This effect is independent of insulin and does not rely on pancreatic beta cell function, making SGLT2 inhibitors suitable for use in various stages of type 2 diabetes, including when pancreatic function is compromised. Additionally, SGLT2 inhibitors may have other beneficial effects beyond glucose control, such as modest weight loss, reductions in blood pressure, and potential cardiovascular and renal protective effects, which are still under investigation. Overall, the primary mechanism of action of SGLT2 inhibitors involves blocking glucose reabsorption in the kidneys, leading to increased urinary glucose excretion and subsequent lowering of blood glucose levels. Disclaimer: consult your health care professional before making any changes to your medication or lifestyle. We are going to talk about each one of them in brief to see which one is the best and any side effects. Common side effects of SGLT2 medications include urinary tract infections (UTIs), genital mycotic infections such as yeast infections, increased urination, dehydration and thirst. In rare cases, these medications may also cause ketoacidosis, a serious condition where the body produces high levels of blood acids called ketones. It's essential to report any unusual symptoms to your doctor while taking them. Number 1, Sotagliflozin is either as single medication or in combination with other antidiabetic medications, including metformin, sulfonylureas, and insulin. It is approved for use in adults to improve glycemic control and reduce the risk of cardiovascular events, including cardiovascular death, in patients with established cardiovascular disease. Adverse effects. Some individuals may experience orthostatic hypotension, low blood pressure upon standing, and mild hypoglycaemia when used in combination with insulin or sulfonylureas. Sotagliflozin may also increase the risk of dehydration and ketoacidosis, particularly in patients with a history of ketoacidosis or those with reduced kidney function. Precautions. Canagliflozin is not suitable for patients with severe renal impairment with eGFR less than 30 or end-stage renal disease, or those on dialysis. It should be used with caution in patients with a history of genital mycotic infections, urinary tract infections, or volume depletion. Canagliflozin is not recommended for use in type 1 diabetes or diabetic ketoacidosis. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Number 2, dapagliflozin also works by the same mechanism. It is taken by mouth as a tablet, once a day. It can be taken with or without food, but it's important to follow the dosage instructions provided by your healthcare provider. Apart from helping to control blood sugar levels, dapagliflozin may also offer other health benefits. Some studies suggest that it can lead to modest weight loss, as the excretion of glucose in the urine results in a loss of calories. Additionally, dapagliflozin has been shown to lower blood pressure in some people, which can be beneficial for those with high blood pressure or hypertension. As outlined earlier, UTI and genital yeast infections, increased urination, thirst, and dehydration are common side effects. In rare cases, it may also cause ketoacidosis, a serious condition. Talk with your healthcare provider about any medical conditions you have, especially kidney problems or a history of UTIs or yeast infections. Additionally, dapagliflozin should be used with caution in elderly individuals or those with impaired kidney function. Dapagliflozin may interact with other medications, including certain diuretics, water pills, and medications that lower blood pressure. It's crucial to inform your doctor about all the medications, supplements, and herbal products you are taking before starting dapagliflozin. Number 3, empagliflozin also works in the same way. This is the medication I have been taking for the last 10 years and I had no issues to report. It is well tolerated in my case. Empagliflozin is typically taken orally, usually once a day. It can be taken with or without food. The dosage may vary depending on individual factors such as kidney function and response to treatment. It's essential to follow the dosage instructions provided by your healthcare provider. Other than lowering blood sugar levels, empagliflozin may offer additional health benefits. Researchers have shown that it can lead to modest weight loss. Also, empagliflozin has been associated with reductions in blood pressure, which can be beneficial for individuals with hypertension or those at risk of cardiovascular complications. Empagliflozin also has side effects similar to other SGLT2 medications. Empagliflozin may not be suitable for everyone. It's essential to inform your healthcare provider about any medical conditions you have, especially kidney problems or a history of UTIs or yeast infections. Additionally, empagliflozin should be used with caution in elderly individuals or those with impaired kidney function. Empagliflozin may interact with other medications, including certain diuretics, water pills, and medications that lower blood pressure. It's crucial to inform your doctor about all the medications, supplements, and herbal products you are taking before starting empagliflozin. Clinical studies. Empagliflozin has been studied extensively in clinical trials. The EMPA-REG outcome trial demonstrated significant reductions in cardiovascular events, including cardiovascular death, non-fatal heart attacks, and non-fatal strokes, in patients with type 2 diabetes and established cardiovascular disease who were treated with empagliflozin compared to placebo. Number 4, ertagliflozin also has a similar profile. In addition to lowering blood sugar levels, ertagliflozin may offer other health benefits. Studies have shown that it can lead to modest weight loss due to the loss of calories through increased urine glucose excretion. Additionally, ertagliflozin has been associated with reductions in blood pressure, which can be beneficial for individuals with hypertension or those at risk of cardiovascular complications. Side effects and drug interactions are similar to other SGLT2 drugs. However, it is essential to talk with your healthcare provider. Do not forget to click the like button and subscribe. Up above you see a video related to other diabetes medications. See you in the next video.